All right, we are back at the Lightning Step couch. Sitting to my left here is Brian Giebink with HDR, an international architectural and consulting firm headquartered out of Omaha, Nebraska. HDR provides innovative solutions for mental health spaces. And Brian here is the mental health practice leader. Brian, I appreciate you joining us.
Thank you. Happy to
Thank
be
you.
here.
Absolutely. Tell us a little bit what about HDR does
Yeah.
and what your role is here at GXC.
Yeah, happy to. So HDR is an international architecture and consulting firm. We design a lot of different types of spaces, primarily healthcare. That's really our number one, any type of healthcare space. In my specialty, what I focus on specifically is mental and behavioral healthcare design.
Okay.
And so that means whether it's an inpatient or outpatient setting, intensive outpatient, partial hospitalization, crisis centers are becoming very popular. I'm heavily involved in those projects, and I help lead the design of those projects. So I'm interacting with others. I'm interacting with clinicians and nurses and people with lived experience to make sure that we're designing the spaces appropriately.
Awesome. What does can you expand a little bit about how architecture can help within mental health spaces?
Absolutely. So in a lot of other types of building environments, there are many other factors that contribute to somebody's well-being. In mental health care space, the environment is often the only thing that a person struggling from mental illness has to cope with their illness. It's the compassionate care of the staff, and it's the built environment. There's not a lot of fancy equipment. There's not a lot of technology.
Absolutely.
It's really the environment and the experience that person has that can really make or break that entire experience and their healing journey.
Okay.
And so we spend a lot of time focusing on the psychological, the physiological, and the ecological aspects of the built environment, and how basically what that means is the built environment stands alone, but in reality, it impacts so many things. It impacts not only the people inside the building, but it influences the natural habitats around the building, the community, the people that interact with the building from the outside. A building can actually make or break an entire community if you think about it.
Yeah.
And then especially with mental health care, it can, as I mentioned, have a very significant impact on the well-being of the occupants inside.
It's awesome. I never really thought about that too much, about how architecture can play a role in that. Where can we see your work being done?
So all over. So as the national practice leader for mental health care design, I'm involved in projects across North America.
Okay.
We have a few projects going on right now. One is in Utah for children and youth. There's another one in Omaha for children and youth that we're doing. It provides inpatient, outpatient care, crisis stabilization, family support, all of those really important aspects of mental health and the continuum of care, all in one place. So Omaha is a great place. And then a project I'm very, very passionate about is one in Vancouver.
Okay.
We just finished. It's called Healing Spirit House. It's a mental health treatment center for youth in Vancouver.
Yeah.
Very, very beautifully designed, and just you feel a sense of hope and belonging. It's built on indigenous land, First Nations land, and so we paid a great deal of respect through the design process to that First Nations.
Okay.
So you just feel a great sense of belonging. And the cultural respect of the people when you experience the space.
I think that's important to have that cultural respect and to tie that into the architecture. I really think that's incredibly interesting. Um, Other than coming to GXC because it's here at Walt Disney in Orlando, what are you hoping to get out of this conference this week?
So I'm hoping to learn a lot.
Okay.
I'm hoping to learn from others. As I mentioned early on, a lot of what I do is interacting with people with lived experience and clinicians, people that are really involved in the day-to-day. Because I'm just an architect, right?
Yeah.
And so I know what I know, but it's really important that as I'm designing spaces that I learn from others and I learn what they're going through, what challenges they're facing, so that I can appropriately design the spaces to support their needs. And so I'm really just enjoying learning and connecting with others and hearing about their experiences, hearing about their built environments and how they may be working or not working.
Absolutely.
And so it's all about connection. We've heard a lot about connection for the last couple of days since I arrived, and really that's what it's about.
Awesome.
So
Awesome. Yeah, I think making connections, learning what's going on in the industry, that's what these conferences are about. And I think this is one of the best ones to be at.
Absolutely.
Again, I'm with Brian Giebink out of HDR, the International Architecture and Consulting Firm, headquartered in Omaha, Nebraska. Brian, I really appreciate your time on the couch today.
Likewise.
Yeah, enjoy your time here.
Yeah. Yeah. Thank you.
Thank you.
All right.